Kasirer, and I am the CEO and founder of Robyn. We are a maternal health and wellness company, and we power prenatal and postpartum virtual care. We have a network of 200 specialized care providers, such as lactation consultants, maternal mental health professionals, doulas, and we have a 75,000 parent community across social media and email. I started Robyn because I didn't want any parent to feel as alone or confused as I once did on my path to parenthood. Given my background in finance and economics, I quickly realized how systemic these problems were and that it didn't just affect parents, but it also affected providers and payors as well. We spend more than any other country on maternal health care, yet we have the worst outcomes in the developed world. All of us women today giving birth are 2 times more likely to die in childbirth than our mothers were just 1 generation ago in the US. And for every 1 maternal death, there are 70 near misses, which is where a huge portion of this $32 billion cost of the maternal health crisis comes from. We need to be putting expecting and new parents at the center of care and finding ways to reduce this economic burden on the system, which is mostly being carried by payors. COVID has only exacerbated these problems and really changed the way we view the hospital, which is where 98% of births take place. So what does this start to look like when we start taking better care of our parents? Just these 3 modalities, mental health, lactation, and doula, could result in cumulative savings of $47 billion per year. And all of the patient outcome data all agrees. Lower C-section rates, healthier newborns, healthier mothers, increased health literacy. It really is a win-win-win for patient, provider, and payer. So why hasn't it happened yet? Now that we have 200 of these specialized care providers in our network, we understand their business intimately and how fragmented and localized it is. It's no wonder that payers are having trouble building a bridge with this type of specialized care community. That's where Robyn comes in. We are building the bridge between traditional perinatal care, clinical care, and specialized holistic perinatal care, such as doula, lactation, and maternal mental health. Our solution has a 2-pronged approach. The first prong you see here, we've built a full services perinatal concierge where we meet parents in their urgent moment of need. So if you can't get your baby to latch or you just want to ask someone, is this normal? It's powered by our conversational AI, which we call our digital doula, and real Robyn providers. The second prong to our approach is actually offering in-network specialized perinatal care through a virtual clinic. So we are going to be contracting and credentialing our providers with the major insurance carriers to be able to offer this service. A little bit about business model. We've outlined kind of current and future. Current is based off of the concierge product, where we're acting almost as a vendor, contracting directly with hospitals, health systems, and payers, where we base it off of the number of births, the number of wellness providers we need to staff. This gets our first few pilots off the ground, gets us to about 2 million in ARR, and sets us up for a strong Series A. The future business model is where this becomes really scalable when we're actually billing for the reimbursable services ourselves. So $1,000 average spend on these wraparound services. Long term, we need to capture 2.5% of births to be able to get to 100 million in ARR. We have an incredible team that is really set up to be able to scale these services and deep expertise in maternal health and wellness, engineering, marketing, payer relations. We are raising our seed to $3 million seed round. Our previous round of funding was a $1.2 million pre-seed done back in November 19. All of our insiders are participating in the seed, so in the institutional ones, Mavron, Kairos, and Basecamp. So we're about 1/3 committed. We are looking for the right partner with healthcare expertise to lead and price the round with us. Thank you so much for your time, and I look forward to answering some of your questions.